The heart is a pump, as a matter of fact, a pulsatile pump. Now this might sound very obvious to you, but it was not for generations before Harvey discovered the circulatory system, the function of the heart valve, and the function of the heart altogether. Now in this chapter you will learn how blood flows within the heart and how this is relevant to echocardiography. Basically there are three different types of flow, of blood flow: laminar, turbulent, or vortex flow. Laminar flow is defined as non-turbulent motion of fluid in which parallel layers have different velocities relative to each other. So we have flow, which is parallel. This usually occurs in situations where the maximum velocity of blood is below 1.5 meters per second. And most flow that we have in the heart is below 1.5, unless we have some form of pathological state. The typical finding that we see in the Doppler spectrum is that of a flow profile where we have a very distinct outline of the curve. In contrast, turbulent flow is defined as flow of a fluid in which its velocity at any point varies rapidly in an irregular manner. This occurs if we have high velocities, for example in the setting of a stenosis, and there we have very many different velocities and thereby turbulent flow. Since we have very many different velocities, the inside of the curve in the Doppler spectrum is also fairly homogeneous. But how does blood flow in the heart, specifically in the left ventricle? Well, it enters the left ventricle via the mitral valve and then it moves more towards the lateral wall until it reaches the apex during diastole, and then during systole and during contraction, the blood flow turns around and moves towards the LVOT, out through the aortic valve and into the aorta. Very important, this typical blood flow pattern is what we see in normal hearts. In patients who have, for example, a dilated left ventricle, the flow pattern in the left ventricle looks slightly different. High velocity jets are usually found in situations where we have a stenosis, for example, aortic or mitral stenosis, but also if we have large gradients between two chambers, such as the aorta and the left ventricle in aortic regurgitation, or the left ventricle and the left atrium with mitral regurgitation. High velocity jets are also seen in ventricular septal defects, as long as they're small, in a patent ductus, and if we have severe forms of coarctation. Low velocity jets are usually found in situations where we have communication between two chambers where there is not such a high gradient, for example between the left atrium and the right atrium in the setting of atrial septal defect or a patent foramen. If we have large communications, especially large VSDs, but also other large communications, for example, fistulous communications or a very large aneurysm or whatever. Another form of flow, which is important to know and which has really attracted a lot of interest lately, is the so-called vortex flow. Basically, vortex flow is defined as a spiral motion of fluids within a limited area, and vortex flow can also create a lot of suction, as you probably all know from tornadoes. This suction can be important also in the function of the heart, for example, during systolic function and diastolic function, to steer the opening and closure of the valves. But this is an area of research which has just begun, and I'm quite certain that this will become very important maybe in the future also to assess disease entities. But why am I telling you all this? Can we actually see the blood flow? Yes, we can. Not only with Doppler and color Doppler, but sometimes also in the 2D image, especially if we use very high frequencies and if the blood flow is fairly slow. Here are some examples. This is a patient who has a very large left atrium, and we can see the swirls of blood as they flow in the left atrium, and even more so in this structure here, which is the left atrial appendage. Another example, again, the left atrium, but this time from a transthoracic approach. But we not only see slow flow, but we also see here a large thrombus. And this is the patient who had a myocardial infarction, and we can see that there is a slow flow phenomenon here, especially in the region of the lateral wall, and an example of an aorta where we also see the swirls of blood. Now this information can be clinically important, but this is an issue that I will be talking about in later chapters. One cannot talk about fluid dynamics without mentioning the name Daniel Bernoulli. Daniel Bernoulli lived in the 18th century, and he was a Swiss-Dutch physician, or actually mathematician, and he was the one who describes the relationship between the flow velocity and the gradients. A very important finding, because this is very relevant also for echocardiography, because with the help of the Bernoulli equation we can extract a lot of information with the help of Doppler, as you will see later. Now this is his original formula, which is very complex. The good thing is we can use this simplified formula. Now imagine we have blood flow through a narrowing. Then we have a pressure gradient between the area before and after this narrowing. And we can calculate the pressure gradient using the velocity. And the formula works like this. You take this velocity, square it, and multiply by 4, and then you get this pressure gradient. In other words, the gradient between here and here. So, very simple actually. And because we can measure velocities and peak velocities with the help of Doppler, as you will see in the next chapter, we can also calculate gradients, which are important for the quantification. We can calculate gradients between the left ventricle and the right ventricle in the setting of a VSD, between the left atrium and the left ventricle to quantify mitral stenosis, between the left ventricle and the aorta to quantify aortic stenosis, and also to measure pulmonary artery pressure, as you will see in later chapters. I hope you now understand how powerful echocardiography is. We can not only visualize the flow of blood within the heart, but also understand hemodynamic problems and even quantify lesions. How we quantify lesions will be discussed in the next chapter. In that chapter, we'll talk about Doppler.